This small group session involved a challenging clinical interaction presented by a gastroenterologist. He discussed a patient who presented to his office in an angry and somewhat threatening fashion. The facilitated discussion that ensues is different from a typical case presentation, since the focus is on personal reactions, thoughts, and feelings. This is similar to a Balint Group, where the participants can ask questions and offer suggestions to help increase understanding of the issues and to help the presenter improve his or her interactions in the future.
Does anybody even discuss it, or if not, role play it, or bring it up as a question or a concern?
I'd love to hear comments on my case.
Which one was yours?
The one you probably can't read.
You are in charge. Why don't you tell us about it, and then we'll see what we can do.
Well, this patient was very traumatizing for me, and one of the reasons I'm here. She's a 38-year-old woman, college educated. She's a former EMT. Is this what you want to hear? You want to hear?
Yeah. Exactly.
She's on disability due to, I'm not sure why. She comes to me for the first time with diffuse abdominal pain and bloating, severe nausea and vomiting. She can only consume 8 ounces of liquid a day, no food, profuse diarrhea. She felt great until 2 months ago. She says, I'm dying of weight loss and dehydration. She's accompanied by her husband, who's very supportive. I don't get to learn the details, but apparently the husband nearly died about 2 years ago, and his wife was there for him and got him through the medical problems, and he survived, so now he's very indebted to her. Very supportive, very validating of her symptoms. She's had multiple ER visits where she's usually given pain medicines and Phenergan, and hydration gets better. Past medical history is interesting. She had a Roux-en-Y gastric bypass in 2003, lysis of adhesions, and some revision of the gastric bypass 5 years later, an appendectomy and a hysterectomy. She has severe PTSD, the inciting event of which is assault, she says, by one of her former physicians. And she's been assaulted, she says, by multiple physicians. She's had exhaustive workup. The only test to note that's been positive is a HIDA scan, which was negative, but injection of CCK did replicate her symptoms. So you walk into the room, she's got her arms crossed, she's standing up, her husband's seated, you shake her hand and she's already very angry and hostile. You meet her for the first time. So what do you do with the patient that won't even sit down and talk to you?
Okay. Let's have some discussion around it first. First of all, how are you putting this together in terms of her?
Well, I don't have a lot of records on this lady, but clearly she's furious at something. I don't think it's me because I've never met her before and I'm on time. Our front staff isn't that bad.
But
It may be you.
it's
Because you're a physician.
in quotes.
A white
yes,
coat.
right?
Yeah.
It's definitely you.
She was assaulted before several
It's
times.
interesting that she didn't request a female.
Well, she may have in our community. There's not a lot. I guess my first impression, besides fear, is that she's over the past several months, this has become the focus of her life, and she's getting a lot of attention for it from her husband, who's very caring and supportive. Her anger is a way of exerting power in the situation where she might feel helpless. She's very prickly and won't discuss anything she doesn't want to discuss. So this is someone that's had bad experiences in the past. I need to figure out how to get in there and get her talking to me and have her open up.
What do you think the issues are as to why she's coming?
Well, she says she's had a recent onset of this pain and not being able to eat, but looking at her history, I gather she's probably had GI complaints for years and years. And
What's her body mass? I mean, she's had a gastric bypass. What's her weight now or her BMI?
It's a healthy weight. Her BMI is about 25.
So she dropped weight and stayed there?
She says.
Okay.
At the first visit, yeah.
And we know she had the gastric bypass?
Yeah.
Okay. I also am curious about the assault by multiple doctors. Do you know more about that?
I don't, and I asked her about it, and she's willing to talk a little about it. She says, basically that, she was in for exams and whatever happened during the EGD or the surgery, when she was coming out, she got hit and slapped and thrown onto the floor.
After the exam? Okay, this was physical assault.
Yeah. And this is what she says.
Yeah.
Is this one episode?
She says there's several episodes by
With the
different
same,
physicians.
different
The
physicians.
same physicians?
I
mean,
different.
Different.
The same hospital? This is what she's reported.
Yeah, this is a red flag to me right away. Multiple procedures, multiple physicians. Husband is there. She had to take care of her husband for years. It's almost like she's seeking attention of some sort. And I would certainly try to ask more of an explanation. And I think I would go try to investigate her reports, because that puts you at risk as the next physician in line.
Yeah.
It just doesn't make sense. Assaulted twice, two different people.
Right, the statistics would be crazy for that type of thing.
Yeah. Do you know if she reported it?
I don't know anything about the veracity of her statements.
And I would also want to know whether she has any lawsuits pending, because that itself may be part of what is driving the illness behavior.
And I would love to know that, but it doesn't strike me as a good way to start.
Oh, no, I'm not saying no. I'm not saying that. And that's not the opening question, but
Well, what's interesting is that, while we want to focus on the case and improving the communication, it is a red flag, and I'm just curious, just as an aside, should someone else always be in the room with him?
Chaperone, yes, I know.
A chaperone and a female, and she's here to help, and listen and see how we can help you. And
Well, in a more general sense, there are two agendas. One is the very nice wanting to help her. You're saying, I want to get to the bottom of this and help her. But there's also the question of how you might be affected if you're going to be in a somewhat defensive and almost attacked position. I think the red flags that people are picking up is you may be the next one.
Mm-hmm.
And so there may have to be two things going on. One is finding out for yourself. I think the first start would be, what do we know about these multiple attacks? You could ask that and try to find out more about verification of that.
But you said this has already traumatized you. I mean, you want to find a solution, correct? When does she come back?
Well, she missed her follow-ups.
We may construct something here, but tell me what the visit was like. How did it go?
It was very tense, and I gathered as much information as I could. Shortly into the interview, I pointed out, well, your labs are fine, your blood pressure's great, you're not tachycardic. And according to the records I have, you haven't actually lost any weight. She stormed out of the office and gave my secretaries the finger. And her husband stayed in the room for a while and wanted to come up with a plan for her anyway, which we did. And then he eventually left and returned several hours later wanting to talk some more, which we did.
And what did he say?
She's very touchy because of her history, which is reasonable. And she's very difficult to work with, but I want to help her, and I want you to be able to help her. What do you think is going on? What's wrong with her? What's her medical problem? What can we do now?
Okay. So I think we got actually two aspects to think about. One is how you could be affected if you felt you were to be attacked. That might interfere. And what does Kenny Rogers say? You have to know when to hold and when to fold. So it may not work out. But the other thing is you have to go with what's the big thing in your face right now, and that's this question of assault. So I think it might be helpful to get the information about that to help yourself as well as her, and try to get her story around it. And by getting the story around it, that could give you an opportunity to feed back to her. Are you having concerns with me? Is there anything I can do? So you kind of put yourself at a more equal level, because someone mentioned this power differential. That she's standing up, which means she has to be in a dominant position, right? Another nonverbal signal. So you would basically stand on the chair and get a little higher than her.
Did you sit during the interview, or did you stand?
I did. When I first walked in, before I realized quite how hostile she was, I asked her to sit down, and she did at
she
first.
did. Okay.
She stood up after a minute or two.
If we were to role play this, and we may, I don't know, we'll see, this might be a situation where, again, you have to deal with the emotion first. And, I think you could start with a little bit of an introduction, and then you could address that. Probably the way to go about it, since it came out that she was assaulted, is to say, this has obviously been very traumatic for you. I wonder what it's like just to be here. And in doing that, you're giving her the opportunity to respond. You can gauge, again, active listening, you can gauge how you're going to do. If she says, oh, it's not a problem, well, that's going to be harder than if she says, well, I don't know what you're going to be like. I just really can't trust doctors anymore. Still in the back of my mind, I'm worrying about this standard deviation of this, to have multiple doctors assaulting her. And sometimes what happens is there could be one bad experience, and then there's a tremendous amount of embellishment in the interpretation of what doctors might do. And that's a signal for you to be sure you have the chaperone. You have, and you're asking a lot of permission and things like that as well.
Yeah, I definitely got that sense there was a lot of embellishment, because things that I did have documentation of, like her EGD, she says, I had ulcers everywhere, and there's no mention of ulcers, it's gastritis.
Okay, so now we're moving into yet another issue, which is
Lying.
factitious illness, or even Munchausen. And that's why I said, did she have we have documentation of the surgery. You do or don't?
Well, I know from the EGD that she
did,
said the
okay.
reason why, and she's
Yeah.
got lots of
So that she had, but the question is about these other things. Could be an effort to be in a sick role, which has a dimensionality from everything to needing to amplify to get heard to straight out Munchausen. You all know what Munchausen is?
Mm-hmm.
So any other thoughts about what we might want to do?
Yeah, I probably would reach out if she has a primary care doctor, or somebody else has had maybe a longer-term relationship, to get a feel of what their interpretation is too, because I never trust my first visit, because first impressions, sometimes people can really snow me, and this already have red flags from start to finish of your story, just kind of send shivers. But I think I would try to reach out to somebody who might know this woman, to see if they can kind of maybe add or subtract to my feeling.
She did in fact have a therapist in the area who she'd given up seeing about a year before, but if she ever does come back, I think one of the ground rules is I need you to reestablish a relationship with your therapist, and I think I should talk to the therapist too.
Is it standard procedure when somebody misses an appointment that you call back to reschedule, or is it just a lost opportunity?
Usually it's up to the patient.
Did you have a sense about why she did not come back?
Well, I think she was upset about being confronted, and I certainly tried not to make it a confrontation, but the facts were that she really didn't seem to be losing weight, and there's no way she's surviving on 8 ounces of liquid and nothing else a day. I thought she would come back based on talking to the husband, but of course the husband's just a middleman, and So I think I just didn't give her what she was looking for, not necessarily in a bad way, but
Yeah.
what she wanted from the doctor wasn't there.
But did she come because she had some expectations that she hoped would be met? And if that is the case, what is that expectation? You know, so, and then the question is, will you be able to meet it all? But at least you may figure out what the expectation is.
I think addressing the expectations early and setting goals early would have been key in this case, and it's something I've learned these past couple of days.
Yeah, and it's all a question of not getting stuck, you know, knowing, kind of reading the tea leaves, so to speak. I would worry that if I said to her, what are your expectations? It might be something, well, I want you to take this pain away, you know. That would that would lead us to try to say what else? How else is your life being affected by this? And while you're doing that, you're really maintaining, I think this is where a lot of questioning and getting their views is helpful, because she wants to be in control. So you don't want to, and I think if you think about it that way, disagreeing with her takes her out of being in control, but at the same time, you know it's not true what she's saying. So you have to find this kind of happy medium, and sometimes you just don't address it. I think the term I heard today, I'll remember, is breathe through it. You hear it, you register it, and it may come another time that you're going to kind of address that issue.
I think if he really wants to take care of her, and part of me has fear. I almost want this woman not to come back, and I don't know if you ever felt that way. And it's great that you're presenting this case, but you know, I think if you really want to take care of this patient, making that phone call at the office, you know, it's almost like you said, hey, this guy cares. He's making the effort. You know, you have to be, then if you jump in, you have to be ready to swim.
Right.
So I think if you made that call, you know, I think it may mean the world and open up the door. You don't know how other interactions were, so you have to make that choice.
Well, I like the idea of the office calling, because it's a surrogate for him. And I think when you've established a relationship, it might be different. You might want to make the call the next time, but I think that what we're hearing, a consensus, is some response back could be positive, and you have nothing to lose by it.